locomotion is change in the position of the locus with respect to the surrounding medium. No surrounding medium, like in outer space, you can't move. So when they have to move there, they take a gun and shoot. And the recoil of the gun makes you move in the opposite direction. There are different types of locomotion. Walking, hopping, running, jumping, jogging, crawling. But out of that, walking is the one which is most economical. For a greater distance, if you want to travel and use minimal energy, walking is the mode of locomotion. Hopping is a very poor form of locomotion, but sometimes you require. Hopping and jogging are meant to spend energy when you are trying to lose weight. Running is the second best economical mode of locomotion. Only after walking. Running is only meant for speed. If you want to reach a destination faster, you should run so that you reach it earlier. Walking is a little slower than running.
Hopping, what happens is with hopping, we are become slower. In your childhood, you must have gone into that hopping races when that sack was put. At that time, you do hopping. But when a leopard does hopping, his speed increases. Our speed, because we are two-legged, it reduces. Yeah.
Here what you are seeing is, this is from childhood to old age. In childhood we are four-legged, then we become two-legged, and finally we become three-legged, we use a walking stick. Although this might seem evolution, it's actually our own life from childhood to old age.
Next.
What you are seeing here is that the red color spots is a weight bearing area. Suppose you are a 60 kg person and you are standing on one foot, the entire weight comes onto that foot. When it reaches the talus, it splits. 30 kg goes to the heel and 30 kg goes in front. In front there are 6 toes. 6? Actually, the head of the first metatarsal has got 2 sesamoid bones, which are the weight bearing part. So that 30 kg in front is divided to 5, 5, 5, 5, 5, 5. 2 sesamoid bones carrying the 10 and the other toes carrying 5 each. This is when you are standing. The anterior arch gets flattened. Whereas when your foot is off the ground, the weight bearing are the great toe and the little toe. That's why shown with a slightly bigger circle. What you can see here, and what you can see of Yuvraj moving, when you take one step forward, the heel is the one which touches the ground first. And then, after it takes a step, the entire weight goes into that lower limb. You are concentrating on the right side. The left goes off the ground, and then the right also leaves off the ground after the left touches the ground. When it touches the ground, it is called stance. When it leaves the ground, it is called swing, because the limb is swinging. So we have got 2 clear phases, the stance phase and a swing phase, when it comes to one walk cycle. What is a walk cycle? Before that, some terms that are used. Advancement of one foot, that means the distance from right to left foot, how much he has advanced forward. It's called step length. Whereas stride is heel strike of one foot to the next heel strike of the same foot. That is called stride. Step length is the distance that you have traveled. Stride length is equal to 2 into step length. And stride width is the horizontal distance between the 2 feet. See the diagram. Left limb is shown touching the ground from below. Right limb is touching the ground next, and then again the left limb. From heel strike of left to the next heel strike of the left is called stride, which is equal to 2 steps. And when you're talking about step length, we are talking about the perpendicular distance between the heel strike. Don't take the oblique line. Cadence have number of steps that you walk per minute. A cadence differs from individual to individual. Each one of us has got a natural cadence. If you deliberately alter your cadence, you will get tired faster. There is a movement which is called as mourner gait. Mourner, mourner. When you're carrying a dead body to the crematorium, you're walking with a group of people. Suppose you have a habit of traveling faster, then you will leave the group and you want to follow the group. So what you have to do, don't try to change your cadence, because velocity is equal to cadence into stride length. What you have to do is reduce your stride length, don't change your cadence. Reduce your stride length, automatically your speed becomes slower and you are with the rest of the crowd. Okay? So, of course, if you are slower, you have to increase your stride length, don't change the cadence. So, that's the least thing that you can do as a respect to the dead person, which you could never respect him while he was alive. In the walking, there is a phase which is called as double stance phase. That means both the feet are touching the ground. This is double stance. And in running, there is no double stance, only one foot touches the ground. And before the other foot touches the ground, your left foot has raised up. That's in running. So in running, there is no double stance phase, there is a double swing phase, where your body is moving forward by its momentum in the air. There is a speed walking race that we have seen in the Olympics, where they walk quite fast. What they are doing is, they reduce the double stance phase, but there has to be a double stance period. If you go into double swing, trying to run a little faster, move a little faster, you are disqualified. So if you get a chance to take part in walking race, just walk your normal speed and assume that those who are in front of you get disqualified. So what they do is video photograph the foot of the person. Moment double stand, moment double swing occurs, disqualified. Next. So this is the definition of a walk cycle. Walk cycle has two interpretations. One is the time interval or the sequence of movements. Both are called as walk cycle. Which occur from the and the walk cycle, since it's a cycle, like a circle, you have to find out some point where you begin. So heel strike has been chosen arbitrarily as the beginning of a walk cycle.
So heel strike of this foot. So here the walking cycle starts from, this is just a step, and here it ends when the same foot does the heel strike.
So heel strike from one foot to the next heel strike of the same foot. That is a walk cycle. You can see the duration of stance here. Duration of stance is 60% of the walk cycle and the swing phase is 40%. Of course, there are 2 feet, both have got 60% stance. Automatically, you can't have 120%. 20% is the overlap, which is called as double stand. 40, and as I said in Olympic race, they try to reduce the period of double stand. So what they will have is stance of 51% and swing of 49%. That is 2% as a double stand. If you reduce it to 50-50, touch and go, you may get disqualified. So Stance width usually in ordinary walking is 60%. And since the walk cycle we have said starts from stance width because heel strike, we will discuss the stance width first. Stance width is subdivided into early stance, mid stance, and late stance. And early stance is followed by loading response. That means your body weight is now shifting to that stance foot. And then late stance is further divided into pre-swing. Terminal stance is called pre-swing. When you touch after the heel strike, the foot does not go flat to the ground. It goes from the lateral border of the foot. Then it reaches the little toe, and then from little toe it moves to the great toe. So don't think that after the heel strike there is a snap of the foot on the ground. It gently goes forward via lateral border to the little toe and then to the great toe. That's why when you walk, there's hardly any sound produced, except of course you are walking on heels, tall shoes and walking clickety clack, etc. And you can walk very softly. But even then, some sound is definitely produced. And from the sound, at times you can even recognize a person. That's why that dialogue, हमारी कदमों की आहट से मैं तुम्हें जान गई हूँ. Next, let us discuss the stance width in a little greater detail. Initial contact, heel strike, hip within 30-degree flexion, knee is extended but not locked. Quadriceps is the one which keeps the thigh, keeps the knee joint extended.
So, because here sir specifically mentioned that knee is extended but not locked. Now, when you stand in the dissection hall for a long time, body realizes that hamstrings cannot keep the knee extended, so the knee gets locked. Yesterday, you have learned locking. Quadriceps. So you have learned that quadriceps, they lock it. Now, here what is happening is during walking, it doesn't get locked, and therefore, because of excess walking running, we do get pain here. Okay. Now, what happens in a polio person?
Quadriceps is paralyzed. Let's assume that particular type of polio where quadriceps is paralyzed. Now you can't extend the knee. And knee cannot remain in extended position. Quadriceps is weakened. What the person does, he keeps a hand as low on the thigh as possible, pushes the thigh behind, therefore the knee behind, hyperextend the knee. When you hyperextend the knee, it causes locking. So while walking, he's going to push the thigh back so the knee gets hyperextended and you get locked, then you can maintain the erect posture. Because you have to support the body weight on that particular lower limb when the other limb is going off the ground. So you have to walk with locking. Normally we don't walk with locking because you don't have time for hyperextension of the knee joint. Quadriceps keeps it extended. And an ankle, in the heel strike, the ankle is dorsiflexed. Then the ankle has to plantar flex to touch the toes. That plantar flexion of the ankle is done by gravity. So, it is a controlled dorsiflexor's eccentric contraction, lengthening contraction, is what makes the toes gradually touch the ground. Just remember, after heel strike, when you are plantar flexing the foot so the toes touch the ground, it is not done by plantar flexors. It is done by dorsiflexors.
So something like gluteus maximus, we said that it helps from getting up from sitting position. While standing positions, it controls the movement. So here also, when we do the heel strike, we feel that these plantar flexors may be doing this action. No, it is these in a controlled way allow the foot to touch the ground. Okay, dorsiflexion. So therefore, in compartment syndrome, these are the muscles after excessive walkings because they really get fatigued. They are used for this action as well as this action, and therefore these are the muscles which get easily fatigued, and it leads to compartment syndrome.
When you're trying to shift the weight to the now supporting lower limb, is called as loading response. You're loading the weight onto that. The knee is slightly flexed. It's already slightly flexed, and the ankle has now become plantar flexed by 15 degrees. But it has started in the initial phase. Now it is maintained in the position of 15 degrees. But what is important is the mid-stance phase. In mid-stance phase, the other limb is in swing. So the entire body weight comes onto the only single stance limb. The knee is extended in the mid-stance, quadriceps not locking. Ankle is dorsiflexed because your leg is moving forward, and the glute. And what is most important in this mid-stance is the role of gluteus medius and minimus. Gluteus medius and minimus, acting from the greater trochanter, pulls down the pelvis towards the supporting side, which shifts the center of gravity, center of mass of the body is at S2 vertebra. By pelvis tilting, the mass of S2 is shifted towards the supporting lower limb, and that makes the center of gravity pass through the only supporting limb. So there is a little tilt of the pelvis. When this fails to occur, if the abductor mechanism fails, then your pelvis will tilt on the unsupported side, which is what was described by Trendle and Berg. Now, if you tilt the pelvis on the unsupported side, the center of gravity shifts to the unsupported side, you will fall down. So to compensate that, the trunk will tilt towards the supporting side, so that the center of gravity is shifted. So when you are standing on the right lower limb and left lower limb is off the ground, the pelvis tilts to the right. If that fails to occur, trunk has to tilt to the right. Okay? Remember, trunk will tilt on the where the abductor mechanism has failed. It will swing to the right side of the right abductor mechanism failed, not to the left side. One more. Terminal stance is when the hip is being extended, and which is done by hamstrings. But if you are climbing upstairs and the body has to be lifted up, hamstrings are relatively quite weak. And now the gluteus maximus comes in. So when you walk on level ground, it is hamstrings. When you take upstairs, then is gluteus maximus, which is otherwise doesn't come into play. You want to call powerful extension. So if you realize when you climb up the stairs, when you try to reach a mountain, a hilltop, or where the temple is, next day you feel the pain in the gluteus. That's because of continuous accumulation of lactic acid, which is not washed off by the blood supply because you're not accustomed to using gluteus maximus otherwise. The heel, next point is ankle. The heel rises in the terminal side. The heel rises is a powerful anti-gravity movement produced by plantar flexors. Heel rises, powerful plantar flexion against gravity. Your whole body is being lifted up. So that is done by soleus followed by gastrocnemius. And then ankle is slightly plantar flexed because the heel is off the ground. Next point is you give a toe thrust. Then next is called as pre-swing. This ankle is plantar flexed powerfully by flexor hallucis longus. So soleus is called as the first gear of a car. Gastrocnemius is called as the fourth gear, and the flexor hallucis longus, the powerful muscle going to the great toe, is called as overdrive. So first gear, fourth gear, and top gear, fifth gear, overdrive. That's flexor hallucis longus. Remember, flexor hallucis longus, if you have carefully dissected the sole, you will find that it gives two slips to the second toe and the third toe. Because these two, second toe and third toe along with great toe, are the one which gives the toe thrust. Fourth and fifth toe doesn't touch the ground when you're doing toe thrust. So flexor hallucis longus knows that flexor digitorum longus is quite weak. So it reinforces the tendons which are going to second and third toe because they are also responsible for the toe thrust. So here what is see as a footprint, it start from the right to the left side. The right side you can see the heel touching. Second image from the right to left you are seeing that the lateral border of the foot is bearing weight and then it shifts to the medial border and then the heel is off and then the toes are off. That's the image, the footprint is seen on the ground. Next component is the swing phase. Early swing, mid swing, late swing. In the early swing, in fact, early swing, mid swing, late swing, the hip goes into flexion, flexion, flexion. The early swing, knee joint initially is flexed, then it extends, and then finally it flexes again at the heel side. An ankle joint initially is plantar flex after the toe thrust, it goes into dorsiflexion. And this dorsiflexion is also done by dorsiflexor, because it's against gravity. In the mid stance, the dorsiflexion is to make sure that the toes clear the ground. If there is foot drop, then the toes will drag against the ground. So, what will happen is that you will try to take an extra high step to clear the toes of the ground. So, in early swing, hip flexion, iliopsoas. Knee extension, knee flexion, hamstring. Ankle dorsiflexion is dorsiflexus. In the mid swing, hip is again flexed continuously, that's again iliopsoas. But the knee is extended, this is by quadriceps. And the ankle is dorsiflex, which is by dorsiflex. And in the late swing, hip is continuously being flexed. But now, in the initial flexion, iliopsoas, mid flexion is also iliopsoas. Now the foot has got a momentum. If it's not decelerated, it will go on top. So you have to bring it back down to the ground. Hip terminal flexion is done by hamstrings so that there is no excessive flexion. And this is also that action of paradox, which is active lengthening. It is actually decelerating the accelerating hip. The knee is neutral, right flexion, the ankle is neutral. No much room. Although we think that walking is mainly by the lower limbs, there are some other movements of the body also. Head bobbing. When you focus only on the head while walking, the head goes up and down. When you are on double stance swing, take a little extra long step. The head is at the lowest level. And when you take on a single swing, and single stance, the head is at the highest level. Now remember, we all learned in physics, high ball is high potential energy, low ball, low potential energy. So highest position of the head, highest potential energy. Lower position of the head is the lowest potential energy, high kinetic energy. That's also sometimes asked in MCQ. Where does the body have got highest potential energy? Options: heel strike, double stance, what do you say, toes flat, mid stance. So you should understand that is the highest. And besides, if you watch a person walking from front, focus only on his head, then there will be a swaying of the head 2 inches on either side. What was 2 inches up down, it also sways 2 inches on either side. And of course, if your body weight is excessive, shift of center of gravity is greater, the sway will be greater, and then you walk like Sanjay Dutt. There's excessive swing. That much swing you really don't have. You have only around 2 inches swing.
Next.
Upper limb has got also movement. We tend to think when your left lower limb moves forward, the right upper limb moves forward, crossed. Why does it happen? Our body is economical, it will not waste its energy, right? But probably this upper limb movement occurs because evolutionary dogs and horses can trot. They walk cross-legged, right? So maybe that same synapse is retained in evolution. Therefore the upper limb swing unnecessarily.
Only people who take their left leg and left hand together are those who cannot do parade on 15th August.
Another theory which says that why should upper limb move? And you can't expect that same evolution has brought the upper limb movement unnecessarily. In fact, if you try to keep the upper limb stiff, that is possible voluntarily, but you will spend more energy by not moving the upper limb. So then there is another theory which is called as the spiralization theory. When the right lower limb moves forward and left upper limb moves forward, the body is spiralized, and spiral a rope is stronger than loose strands. By spiralization, you are increasing the stability of the body. That's again a theory, devolutionary theory. We have got upper limb movement, which are already there, and then it went to the quadruped, who have started now walking like trotting like humans. But probably the most important thing is maintenance of stability. Let's try to understand. We say when the left lower limb moves forward, the right upper limb moves forwards. That is not the case. When the left lower limb moves forwards, the left upper limb moves backwards. Now, when the left lower limb moves forwards, the center of gravity is shifted in front. And before that foot has gone into his strike, you must require some stability. So that the upper limb moves backwards. Then there is some excessive movement forward and fall in front does not occur while hand going backwards. So it is actually when left lower limb moves forwards, left upper limb moves backwards. Then once the foot has reached the ground, then the upper limb comes back to the original position, and by sheer momentum it is taken forward. So the backward movement of upper limb is active. The forward movement is gravity and its momentum. Okay, now if you carry a heavy suitcase in your hand, the upper limb will still sway, but to a much lesser extent. Why? Because that suitcase is carrying a large load in it, which is slightly taken backwards is enough for stability. So the upper limb will move as much as is required for the stability maintained. Next slide.
Next. So we can move to next. Next.
Any abnormal gait is called as a limp. It can extend from anywhere from a tight shoe to a tight person.
Right person मतलब
Tandem walking is walking in a straight line. We don't usually walk in a straight line. Our imprint of the left lower limb on the left side
ठीक है
and right lower limb on the right side, slightly. But tandem walking is walking exactly in a straight line. That happens when the adductors of the lower limb have gone into slight spasm. The adductors of the lower limb have gone into slight spasm. Instead of the foot touching where it should touch, it moves a little towards the inside. And the right leg also moves a little towards the inside. There is a spasm of the adductor muscles to some extent. If the spasm is excessive, then there will be the right lower limb has the imprint on the left side and left lower limb has the imprint on the right side. This is called as scissors gait. The tandem walking scissors gait are the degree of spasm of the adductor muscles. Remember, if you see the footprint and you find that there is a child who is having a cross-legged scissors gait, you have just seen the footprint, you know that some child with cerebral palsy must have walked by. But before you do that diagnosis, make sure that the child has worn the correct shoe on the correct feet. The imprint is the other way around. Don't just diagnose cerebral palsy. Remember, if you make a rare diagnosis, you will be rarely correct. Hemiplegics don't walk. But when they are recovering from it, they start walking. And when they start walking in hemiplegia, the hip flexors are very weak. Iliopsoas are the last to recover. So if you want to move that hemiplegic lower limb forward, what he has to do is he has to extend the lower limb, abduct the lower limb, and then adduct. That's called a circumduction. So the lower limb moves forward by circumduction. When there is hemiplegic is recovery. Spastic we just discussed about the scissors gait.
next spastic. So spastic is the scissors gait because the adductors are in spasm. So this goes like this, then the next it goes like this. This happens classically in cerebral palsy.
So what you do is that this is very distressing and person tends to cross his leg, he might even fall actually. So
Which nerve will you cut?
You cut the nerve which supplies the adductors. Which is that nerve?
Obturator. But the
Where is
whole
the obturator nerve situated? Highway. It is in front and behind the adductor pelvis. Anterior division in front of adductor pelvis, posterior division behind adductor pelvis. So you palpate the adductor longus, go deeper to adductor longus and cut the anterior division. Don't cut both the divisions. The anterior division. So at least part of the muscles get paralyzed. So the adductors having the spasm reduces. Automatically the cross-leggedness also reduces. At times you may require to cut the other one also. But don't worry, peripheral nerves when they are cut, they also get healed. And hopefully after healing, there won't be that much of a spasm. And then you have to reoperate. Shuffling means you are not taking your lower limb off the ground. You are walking with a shuffle. So, that classical lifting of lower limb swing phase doesn't occur. You are actually dragging your feet forward. That's called shuffling, classically seen in Parkinson's gait. What is there? Is that the head and the tongue are bent forward. He's trying to catch his center of gravity and therefore he moves. And this movement is a little faster than ordinary walk. He is actually seen to be running. It is easier to run because running is done by cerebral cortex. Walking is done at the subcortical level. You can talk to a person comfortably when you are walking and you're walking from, say, Bombay Central to college, and you're two of you together. You walk, talk, and suddenly where is it reached? People also walk from biker also. I feel for the shared taxi, people have started walking lesser and lesser. And people are nowadays not even climbing stairs. Of course, this is his fourth floor. Even fifth floor is actually 7.5 floors. Because each floor is 15 feet high. Unlike ours, you feel you climb only 5. So your saves little too much. The ability to run is faster, better than walking because cortical movement is easier in Parkinson's. Subcortical movement is what is affected.
And another most important thing is the automatic associated movements are stopped. Therefore, normally the hand moves. So in Parkinson, classically, you will never see a hand movement. The person will be walking like this.
Because he is walking with the help of cortex. The hand movement is subcortical. The subcortical movements are all affected. First step of walking is cortical. After that, the walking becomes automatic.
And you cannot stop also.
Stopping also is difficult. And restarting is again a problem. Feet are planted wide apart, cerebral ataxia. Because of imbalance, you try to take a broader base. Broad base means you can easily support the body somewhere
So
in
he
between
walks.
the base. Broad base. And the person sways from side to side and he will even walk. If you ask the person to walk with eyes closed, he will turn towards the side of the cerebellum affected. So when you want to find out which side the cerebellum is affected, ask him to close the eyes or tie his eyes, ask him to walk straight. He thinks he is walking straight, actually is taking the circular path, and that toward the direction in which you are taking a circular path is the direction of it. Cerebral gait and drunkard's gait appear the same. But the main difference is to find out whether it's cerebellum or he has drunk, that's why. In cerebellum, the swaying will occur from side to side. In a drunkard, it will occur from front to back. If a person is acting like he is cerebellum problem, if you find that he is moving front to back, he has drunk. Cerebellum will sway side to side more. In a drunkard, cerebellum is affected, but both cerebellum are equally affected. So he will sway neither to the either sides. Move front back. Right? Compass gait is a type of cerebral gait, as you said. You will move along a circular path like a compass. Next, sensory ataxic gait. When you can't feel the sensations of the soul. Tabes dorsalis, that's a type of tertiary syphilis. Peripheral neuropathy. All these things you can't feel the ground. If you can't feel the ground, what you have to do is hear the foot hitting the ground. So you take a higher step and stamp the ground. That high steppage and stamping gait. This is sensory loss. And so you are hearing the sound because the foot has touched the ground. Otherwise you can't feel. You still feel you are walking on clouds.
The
You can't feel the sensation.
sensations of the lower limb are not there for him. So he is absolutely walking on faith of his eyes.
Ah.
इधर नीचे का उसको sensation ही नहीं है. So आवाज, then he understands that my foot has touched. Otherwise, he cannot feel that.
So the point to be remembered here is that we tend to look ahead when we are walking. We don't look at the ground. Then we are going to take the next step. So it is said, we walk on faith. The ground is there. In a sensory affected person, he has to see where he is standing. He has to hear the sound of the foot and he has to see, yes, the foot has touched the ground.
Something, the way you will walk, if you go to your village and they tell you that you're walking in the night and they tell you there is a snake around. How will you walk?
You should use that, what do you say, eyes when you're walking on puddles of water in Mumbai. You never know where there's an open manhole. So don't walk with faith when it's flooded. In contrast, if you have got foot drop, there is a chance that the toes will rub against the ground. So what you will tend to do to prevent the toes from rubbing against the ground, you take a high steppage. So purely high steppage without stamping is foot drop. High steppage with stamping is sensory loss. Sensory loss is usually occurring on both the lower limbs together in neuropathies and other things. So
This is on the most one side only, most of the
lower limbs, whereas
foot drop
usually occurs only on one side. So high steppage of only one side without the need for stamping because sensory is not affected. When there is chorea, there's a condition where caudate nucleus of the brain is affected. Chorea is a Japanese word for dancing.
So basically he has abnormal movements. So आपको लगेगा कि वो stage पे कुछ ऐसा is performing, but this is how he is.
Then jaunty gait next. Hysterical gait. This is to attract attention of the people around. And this person tends to feel that he is falling. But notice, he will never actually fall. He will fall exactly where there is a chair and manage to sit on. He doesn't want to hurt himself or herself. Hysteria, the word has come from hysteros, which means uterus. Hysteria was usually seen in, females who have no sense of responsibility. They are not taught. They don't go to schools and such people. Now they want to attract attention of the people. So they say they do hysterical acts. So it is said when the uterus wanders around the abdomen, that's the time when you get hysteria. So what is the best way to prevent it from wandering? Fix it together by pregnancy. When there is pregnancy, the female now feels responsible that she is going to give birth to another child, which no male has ever done. Then the hysteria disappears. Because now the uterus actually does not wander. It's a mental thing. Next. Paralysis of the abductor mechanism. Paralysis of the abductor mechanism of the lower limb will make the trunk tilt towards the affected side to prevent the center of gravity from shifting. So when he sways on both the sides, both abductor mechanisms are affected. It's called waddling gait. When he is tilting only on one side, it is lurching gait. Now, what is failure of abductor mechanism? Abductor mechanism is a hip joint, which is called fulcrum, neck of femur, which is called lever, power of abductor is called power. So there is a fulcrum, there is a lever and a power. All three can get affected. Arthritis of hip joint, that's a fulcrum involvement, which is unilateral. In contrast, congenital dislocation of hip is bilateral. Fracture of neck of femur is unilateral. Coxa vara, coxa valga is bilateral. Faulty intramuscular injection is unilateral. Unless you go to the same GP who fires the other one also, is unilateral. Whereas myopathies, where there is proximal weakness, is bilateral. So you have now seen 6 conditions, 3 unilateral, 3 bilateral of the fulcrum, lever and power. If it is unilateral, you will have lurching gait, tilting only towards the affected side. If it is bilateral, you will waddle both sides. A duck has got a heavier body and a weaker legs. So when his one limb is on the ground, it's meant for swimming, but it's outside the pond. When it tries to walk, when one limb is on the ground, the body will tilt towards that side. Center of gravity and all those things. The body weight is too high, and the other limb.
Like a duck. Duck कैसा वो?
This also happens in overweight people when the legs become weak. Then you have to model. Myotonic gait, here what happens is the muscle goes into contraction but fails to relax. So that is a spasm of muscle which gives a tonic break and then movement. So it's not a smooth movement. Next. Antalgic gait. Algos means pain. Ant-algos means absence of pain. So when the lower limb is painful, you want to bring out movement where the pain becomes minimal. So what is done is that the other lower limb goes into a faster swing. When the other lower limb goes into a faster swing, the stance of the painful limb is reduced. So when you see a person walking slightly with one swing faster than the other, it appears that that swing which is faster is something wrong. You don't walk that way. You feel that the other limb is the one which is affected. But remember, the faster swing appears affected, that is because the other limb is painful. Just don't give a diagnosis. I think something is wrong with the right lower limb. It might be actually painful left. And if you are giving the person walking, don't give a person the walking stick, he will tilt the trunk towards the affected side. Why? So that abductor mechanism does not go into powerful contraction. The abductor powerful contraction is adding the weight to the lower limb besides the body weight itself. Tilting the trunk, the abductor mechanism stops. So at least that abductor powerful contraction does not cause the lower limb to be more pain. Only body weight has to be more. And if you give the person walking stick, you will also use the walking stick on the painful side. Upper limb is not affected, lower limb is painful. So that the center of gravity did not shift much. You are already giving him a support. Pulsing gait we already said, unilateral failure of abductor mechanism, and then an intermittent claudication gait. The person walks normally, then he gets painful lower limb, then he goes and sits. Then he rests for some time, blood supply to the lower limb and come back, he walks again. And then he goes and sits. This usually happens when you are extremely tired and you are climbing up a hill. In an enthusiasm, you started off very fast. Now you got fatigue. Every milestone that you get on the road, you go and sit. But as the pain further increases, the claudication distance becomes smaller and smaller till it reaches so much of lack of blood supply is that you get pain even on resting. Pain on rest in claudication is usually called as the cry of the dying nerves. Muscles are already dying, now the nerves are also dying. Then this usually happens in smokers. Claudication. Next. Praxis is performance of practiced movements. Apraxia is absence of performing practice movement. Walking is the most practiced movement. If you forget that, you get apraxia of gait. And usually in frontal lobe region, he's literally forgotten how to walk.
Gajni.
Then he starts thinking how to walk, hops forwards, crawls forward, etc. He just forgotten that he has to walk on two lower legs, which is a smooth activity.
नेक्स्ट, ये मैं दिखाने वाला नहीं है आपको. नेक्स्ट. थैंक यू सो मच. बंद.